Hi everyone, this is just going to be information session for anyone who couldn't make it to the other ones. So we decided to record just a real brief one. So we're HCAT, and that stands for the HIV Counseling and Testing Coalition at UCLA. HCAT is a group of UCLA undergraduate students who are committed to reducing HIV and sexual health stigma. We aspire to empower and initiate change in communities affected by HIV through serving ourselves as HIV linkage counselors and practicing cultural humility and cultural competency. And so although prevention methods like pre-exposure prophylaxis and post-exposure prophylaxis and treatment options like antiretroviral therapy for HIV exist, people living with HIV overwhelmingly lack equal access to such healthcare services. Our mission is to combat those barriers. So just looking at the numbers here, we can see that 75.7 million people have been infected with HIV. 32.7 million people have died from AIDS-related illnesses. In the US, there's currently an estimated 1.2 million people living with HIV, and about 240,000 of those people are completely unaware of their HIV status. So of these people living with HIV, only 78% of them were linked to care after diagnosis within a month. Only 65% received any HIV care. Only 50% were retained in any care, and only 56% were successfully virally suppressed or undetectable. And so something that we really have to note is that HIV disproportionately impacts people of color. So here we're highlighting the percentage of Black, Hispanic, and white people living with HIV in 2018. And so what we'll notice here is that although Black individuals comprise just 8.1% of LA County, they make up 19.3% of people living with HIV in LA County. And although white individuals comprise 52.1% of LA County, they make up just 26.4% of people living with HIV in LA County. And you can see that there's a hugely disproportionate impact on the Black community here. And so this next slide actually shows that not only is the disproportionate impact historic, but also ongoing. And so as you'll see here, with new HIV diagnoses, 23.4% of people who were diagnosed with HIV identifies as Black, and 18.9% of people with a new HIV diagnosis in 2018 identify as white. And so you can actually see that the percentage of Black people increased while the percentage of white people decreased. And that just shows that HIV has an increasingly disproportionate effect on people of color, and that it exists today. Another thing that we definitely have to note is that the LGBTQ plus community is very harmed by HIV and is also disproportionately impacted. So something that not a lot of people know is that it was officially called gay-related immunodeficiency disease before HIV was called HIV. Stigma surrounding HIV as a result extended to the LGBTQ plus community. In 2013, gay and bisexual men only made up an estimated 2% of the US population, but 55% of all people living with HIV in US. In 2018, MSM accounted for 69% of new HIV diagnoses in the US and 86% of diagnoses among males. And so you can see here that MSM and the LGBTQ plus community in general is strongly harmed and targeted. So this kind of informs us of our goals. Our goals are to serve and empower communities disproportionately affected by HIV, many of which are comprised of queer, Black, Indigenous, and people of color. Our goal is to reduce the rate of HIV infection in LA County. Our goal is to deconstruct stigma surrounding HIV/AIDS, sexual health, and the LGBTQ plus community during HIV linkage counseling sessions. Our goal is to ensure linkage to care for our clients that test reactive for HIV. And our goal is to create a safe space that prioritizes client safety, comfort, and autonomy during HIV linkage counseling sessions. So what we actually do as a club is conduct weekly seminars dedicated to expanding education surrounding HIV, epidemiology, safe practices, sexual health, and LGBTQ plus culture. We offer free and incentivized HIV testing and counseling to students on campus and LA County residents off campus at our partner sites. We provide harm/risk reduction techniques, HIV prevention strategies, and free resources like condoms, internal condoms, dental dams, and more. And we also refer people to PrEP. We also refer clients to any low-barrier healthcare services in the local area. And so at the bottom here is just a flyer for one of our events in the past. And our partner sites are Safe Place for Youth. They are an access center for unhoused youth. Our other partner site is Illumination Foundation. They are a recuperative care shelter. And our other partner site is Long Beach Department of Health and Human Services, where there is a mobile clinic. And so just as a brief overview for new members, there will be in-person meetings on Thursdays from 6 to 8 p.m. During fall and winter quarter is when you'll be training to become an HIV linkage counselor. And during spring quarter is when you will actually start HIV linkage counseling and gaining that client interaction and clinical experience. So what we offer is mentorship, active clinical experience as an HIV linkage counselor, in-person client interaction, and community service. We'd also like to plug that we can get a free HIV test shipped to anyone with an LA County resident, LA County address. So if you know anyone who is needing to get HIV tested or just wanted to let people know, definitely direct them to our website, hcatucla.org, and they can navigate themselves to the free HIV test with or without counseling page, because we offer counseling sessions through Zoom, optionally, alongside the free HIV test shipped to them. This is completely at no cost. But yeah, if you resonated with HCAT's mission, please apply to join us and serve our community. We'd love for you to be a part of the team. Thank you so much for your time. The deadline is 10/15/2021 at 11:59 p.m. So get those applications in as soon as possible. Thank you so much. Have a great day.